Okay, let me ask this question. Have you ever picked up the phone and called a doctor? I'm not talking about set up an appointment for you. Have you actually tried to start calling physicians to be able to get those appointments? Have you actually started making phone calls to call administrators and nursing homes to get appointments? Discharge planners of hospitals, social workers of, you know, long-term care centers or, other nursing homes as well. Are you making phone calls already? How many phone calls have you made so far within the past few months? How about today, for example? A lot of people feel that they should actually wait till their agency opens. Let's say, for example, you're just starting your agency, or let's say you're just about to start working for a company. If your agency is not up and running yet, now's the time to start learning and practicing and messing up and making mistakes to learn from it. But at the same time, as if your agency is already running, you need to be doing it also right now. But the biggest problem is this, is that when we make phone calls, when we make these cold calls, we are not prepared. We don't practice ourselves. We don't have the right tools. We don't know fully what we need to do to get those appointments. You can't just make a phone call and wing it and just go by how things goes when the other person. The person who comes prepared is the one that's going to win any battle. And cold calling is a battle. It's a battle of getting that person to actually transfer you to the person you want to speak to, and not their voicemail. It's for you to be able to speak to somebody and for them to ultimately see that there's something of value, that they do definitely want to be able to meet with you. Don't just rely on the power of numbers where you start thinking about yourself, like I shared in the other slide, where you talk about, well, Michael, if I talk to 100 people, if I call 100 people within this week, if I can actually get a 7% conversion and get them to actually allow me to have a presentation out of that, I'll do good. Well, you forgot the other math problem. What's your conversion factor of having an appointment? You may have a 5-7% conversion of getting somebody to meet with you, but how about getting that person to start referring patients to you? What if that person you meet or that company you meet is not a good referral source? They only have one patient every 2-3 months. Because remember, it always begins from qualifying the right company, the right people. So it's not just getting an appointment. It's to be able to get an appointment at a higher rate with the right training, the right techniques, to call with knowledge and ideas. Because look, you already have the person in the phone call. You already have the ideal referral source. It's a waste of time if you can't get them and increase your chances to get those appointments.